The Coalition of Texans with Disabilities, Raise Your Voice 2022. Medicaid waiver waiting list, June 20th, 2022.
All right, thanks, Laura. Again, my name is Chase Beard, and I'm the Deputy Executive Director at CTD. And my audio description is I'm a white male, unfortunately in my mid-40s, that is starting to gray because of this job, but I love it. My background is a image of CTD's front building. That way you don't have to look at my messy room here. And I am wearing a white button-up shirt. And I want to thank y'all again for coming. And, you know, for those of you that participated last week, we wanted to start with a poll and to thank y'all because we had some amazing actions done. So I'm going to launch the poll, and I'll read it and just explain why we're putting this up here. So the poll basically asks is if you took action last week. We do this just to help us with tracking our numbers, and so that our funders who like the work we're doing see that, you know, this is something people are getting something out of. And it is, you know, did you take action? The first one is yes. You know, yes, and I got a response is the second answer. The third answer is no, I didn't attend last week, so not sure what the action was, or no. You know, on average, we usually get almost 50% of people taking action, and that has really made a big difference. Last week, we wanted to bring to y'all, since we did our last Raise Your Voice on the attendant wages, we were overwhelmed that by the time we sent that action alert to y'all the next day, it had, by the time we had the interim hearing and went to it, I believe the last number I heard was we had 764 people send in a response. Many got responses, but it shot out and people shared it, and they took action. And I think that's probably one of our highest. There's well over 20 senators, I believe, on the committee. So, you know, you look at 20 times 764, that is a whole lot of emails that went out. Now, what we saw last week while we were in the hearing is the first time, I think, in all the years, and I've been doing this now for well over 15 years, was the Senate Finance Committee actually address and look at the attendant wage issue more than they ever have. And I don't think it was just lip service. I think they really are seeing that where we are at, we need to do more. And we've been having a lot of discussions behind the scenes. And to kind of build on what Laura's saying, you know, there's a lot of complexities to advocating at the state level that are very different than if you're advocating in your local city or county or the federal government. So it can sometimes be quite the trip, trying to start from point A to make it to the end of the game at the end of the session, and making sure that we get funding. So when y'all participate, it makes a huge difference for us, and we really do appreciate that. So I'm going to leave the poll up for a while. You can minimize it if you've already answered, but we want to give people a chance to have some time. And I believe I'm handing it off to Dennis next. Dennis, I'll let you take it.
Thanks, Chase. Thanks, Chase. I'm Dennis Borel with the Coalition of Texans with Disabilities. I'm an Anglo male, gray hair, gray beard. I'm wearing a light blue shirt. And behind me, those are actually recognitions that CTD has received. We have a nice little display in our offices, if we're ever going to open our office again in this pandemic time. Hey, I just got to take just a second here and say, to tag onto what Shay said, this response we got last week was amazing. And that interim hearing, that Senate Finance interim hearing, they didn't, you know, attendant wages weren't going to be the main part of that hearing. They were going to talk about nursing homes. And they did to some extent. But I'll tell you, it was clear to me that the question of attendant wages came to dominate the discussion there. And that is, had thumbs up, double thumbs up to everyone who was there, everyone who sent an email, everyone who passed it on to some other friends, whatever. we were truly not only blown away, we felt like the partnership among the self-advocates of Texas has never been better. So today's topic, wait lists, interest lists, Medicaid waivers. And the first thing I've been asked, so what's the difference between a wait list and an interest list? Actually, there isn't a difference. They used to always be called wait lists because people would qualify or try to qualify, they would try to qualify for services they need to live in the community on the Medicaid waiver level, okay? Medicaid waivers are a richer menu of services for people with more significant disabilities that allows them to live independently in the community. The idea being to qualify for that, an individual is like institutional level of care. In other words, you could go into a nursing home or into an intermediate care facility or even a state-supported living center. So the more difficult, more significant disabilities can qualify. And of course, there's financial eligibility and that stuff. However, the Medicaid waivers in Texas, unlike institutions, this is important, are not entitlements. What does that mean? Well, it means that if you qualify for a nursing home, you can pretty well go right in, or state-supported living center. But if you qualify, and remember the same kinds of qualifications, and want to receive services in the community, in your home, for example, or in an alternate group setting or a small group home or something, you have to wait. Okay, so that's why when I first started doing this, we always call these wait lists. The term interest list came about several years after that from legislators. You know why? Because they didn't want to face the fact that people are waiting. That's the bottom line. So they changed the name to interest list. So it's people who are interested. I am interested in getting services so I can remain at home. Part of me tells me that people who go on the interest list or the wait list exemplify everything that's right about Texans, that they refuse to submit to institutionalization just to get services they need. So this is good. So the wait list, interest list, same thing. Medicaid waivers, higher level of services, richer services, very important for people with more significant disabilities. So there's some things that have been happening this year that have been encouraging. Number one, the Speaker of the House put this issue of these wait lists, Medicaid waivers wait lists, as an interim charge. I don't recall that ever happening, ever in the 22 years I've been doing this. Maybe it did and I missed it early on. Maybe somebody like Belinda can verify whether whether it's true or not. But so that means they're showing an interest. That means they're showing some. Belinda shaking her head saying, no, it's never been on the interim charge. So we have openings. And why? Well, there are some ugly truths right now. And we can talk about Texas is a great state with great people. And I agree it is. But we don't treat people with disabilities very well. And in fact, there are over 169,000 unduplicated individuals on the Medicaid waiver wait list. And when I say unduplicated, what do I mean? Well, there are some people that are hedging their bets. So there's different waivers. So they'll put their name on more than one waiver. And if you counted all them up individually, it'd be in excess of 300,000 names. But we're going to go with the unduplicated because that's a shocking enough number, isn't it? 169,000. So I had an opportunity to give some invited testimony to an interim hearing on House Human Services and talked about this. And one of the things, as I watched HHSC describe it, they talked about the wait and they described people as being, well, the people on the list have been on the average there 7 years. Well, maybe the average person put their name on the list 7 years ago, but they weren't going to receive services. In fact, that was challenged by a couple members of that committee. State representatives said, wait a minute, I have people in my district, my constituents. I just had one now. Representative Hull out of Houston, he said, just got off, been on the wait list 16 years. And they were HHSC was forced to admit that Well, yeah, when we said they're on for 7 years, that just happens to be the average wait for people on it now. That doesn't mean they're done waiting. And you know what else? 16 years is not true. And I'm going to explain that now. And this is kind of what I testified. And I'm going to tell you something, you'll recognize this when I tell you about it. If a person is getting services today and they've been waiting 16 years, that meant they put their name on that list 16 years ago. So what if you put your name on the list today, or your child's name? That's what I'm going to show you right now. Okay, I'm going to share a screen, and I'll tell you, Ashley, I can see you. Nod your head if you can read this screen. Does that look good? Okay. So I've color coded this to make it easier to follow. But this is a spreadsheet I used in testimony. And the question I asked is, how long would you wait if you put your name on the list today, or your child's, and the legislature continued at their same pace? So I'm going to walk you through this, and the different colors are explained. So the yellow thing up there, where did I get all these numbers? Why? I got them from HHSC's website. I didn't make them up. I didn't go over to Disability Rights Texas. I didn't go over to the ARC of Texas, ADAPT, any of those. I got this from the state agency itself. That's the yellow part. Now let's talk about the green part. The unduplicated count of Texans on the interest, 169,120. 169,000. Okay, this is offensive. Let's just call it what it is. It's offensive. And these are unduplicated. So remember, if they put their name on multiple lists, they only get counted once in this number. So the question comes up, again, using state numbers right here, using state numbers. At what rate, as they come off the list, are they declined? In other words, maybe they don't qualify. Maybe they're assessed and they don't qualify. Maybe they're deceased. They passed away before their name got up on the list. Maybe they were denied for some other reason. Maybe some sort of financial eligibility. Maybe they got no response, which means maybe they're deceased. Okay. Maybe they gave up and were moved into an institution. Okay, whatever reason. So what we know is this number right here, 37% of people as they come off list, for whatever reason, are essentially sent away. Okay. And that is, and those are the numbers right off the list. 9,558 were released, were sent away, and 26,000 of all were released. That's 37%. If you divide that, for whatever reason, didn't count. Now, we've known this for a long time, that there are people's names on their list that unfortunately pass away, and their name still is on the list, or they move out of state, or they go into an institution, or for whatever, or maybe they never really were eligible. They never were quite institutional level care. So let's go down here and let's remove 37% of that let's say that 169,000, 37% are not going to qualify for some reason or another. Okay, good. That leaves 106,551, okay, that would qualify. Still a very large number. Let's go down to this sort of orange peach section. And let's see if I can expand this a little bit. Ah, yes. So how many slots might be available in a year? Well, this is new slots that the legislature advocated, 775. Okay, folks, we're saying that there's going to be 106,000 people, and they said, well, we'll fund 775. That's pretty shocking. But there are other ways people can get access to services. And that's what they call attrition, all right? That people essentially die or go into an institution or move out of state. These are the Medicaid waivers. So if you looked across, the CLASS program has 10,939 currently. And these numbers, where did they come from? HHSC, not our numbers, HHSC. That's deaf, blind, multiple disabilities. I won't go to all this, but these are all waivers. Again, community supports for people with more significant disabilities. In all the state, there's around 62,000, according to HHSC. We're going to take the assumption that about 5% attrition will occur. People will pass away, all right? And that may be primarily up here in the STAR plus HCBS, which is the waiver of choice for older adults. But there are other people that leave. So you add this 3,108 and 775, and we're going to say that there's about 3,883 slots that are come up during the year. Maybe more, maybe a little less. This was not objected to by HHSC. Okay, so you take this further down and you divide that 106,000 right here that we said we're going to qualify, not just our waiting, but will qualify, and at a rate of 3,883 a year get services, and you divide that, so the years for today's enrollee to reach the top of the list is 27 years. Okay, now I'm going to leave a little, I want to leave some time for our special guest. So I am going to stop this and just add one other thing that is important to know. And by the way, the committee was attentive to this. The chairman of the committee actually said that his goal would be to mostly eliminate this wait list. But I was thinking he was thinking along ways to, like, what I would call magic dust solutions, where you'd sprinkle some magic dust and people would disappear. So he would think that that we would not count people who are really may not qualify. So that's what I said. We went down from 169 to 106,000. Hey, let's face it, folks, 106,000 is pretty darn egregious anyway, isn't it? Isn't it disgraceful already? So he's got a ways to go. And what I said in my testimony is that you can't wish it away, and you can't come up with other reclassifications. You can assess people. I said, well, let's assess them all and see if they were qualified. Well, they might not quite qualify today, but in 20 years, you know, while waiting for services, they might have had a decline, you know. Anyway, there has to be some, you know, they need to belly up to the bar and put some cash on the table. That's what it amounts to. One last thing I want to say, there is a way to get around the wait list. It's called generally called the promoting independent slots. And those are some slots for people who are at imminent risk of institutionalization. That'd be like somebody whose primary family caregiver can no longer do it, maybe through age or passes away or something like that. So they're at imminent risk. They were doing okay in the community and without a waiver, but now they would have to be institutionalized because there's no alternative. And you can get around that, and that's called the promoting independent slots. But here's what's also true. You know, up to about, let's say 6 to 8 years ago, they would have a different pool of those promoting independent slots. You know what they did now is they combine those slots, so that 775 the whole year includes that. So if anyone gets around the wait list by imminent risk, they actually reduce the number of slots available for those who are waiting on the list. Ugly truth. I'm really pleased, we are all really pleased to have a friend of ours that we've known him for quite a few years, definitely a seasoned advocate around here, the public policy director at the ARC of Texas, Ashley Ford, who's been shoulder to shoulder on these issues for several years. Ashley, it's yours.
Thank you, Dennis. So glad to be with you all today. My name is Ashley Ford, and I am with the ARC of Texas. As far as my audio description, I am a white woman in her early 30s, and I am in a room where I have a sign that says Disability Justice Now framed on the wall, and a variety of plants beneath it. And if you'll excuse the way I sound today, I'm trying to get over a cold. I don't know who gets a cold in Texas in June, but apparently I do. So y'all will just forgive the way I sound. So great to be with y'all. Like Dennis was saying, the ARC of Texas and CTD have been advocating on the interest lists or the waiting lists for decades now, really, long before I was a part of the ARC of Texas. And we continuously are just really dumbfounded by the lack of forward movement that is being made by our lawmakers in Austin on this topic. So here in the past year or so, well, no, I guess in January, we were contacted by the Austin American Statesman because they have a lot of interest in shining some light on this topic of individuals, waiting 16, 17, maybe 27 years for a waiver so that they can receive services in their community and outside of an institution. And they were asking us if we can share stories of people who are essentially, waiting on a waiver. And so what the ARC of Texas has been doing is a campaign, and we're calling it Waiting on a Waiver. And I will put a link to how you can get involved in this campaign in the chat. So essentially what we have been doing is collecting as many stories from people who are waiting to receive services in their our community through a home and community-based services waiver, and letting them know the impact that has had, and really trying to shed some light on the human impact that has on families. So far, we have had over 300 responses. We would love to have some new responses today from y'all if you're interested. The reporters are still actively looking for folks. They have also been actively looking for people who have died while waiting on a waiver. That information has proved really challenging for them to find. So if you have any of that sort of information that you would feel comfortable sharing with us, please let us know, and we will pass it along to the investigative reporters from the Austin American Statesman. The estimated time of arrival for this story that they've been working on for months now is in August. And we are very excited about the potential for the momentum that this could generate for us and this cause. We think that obviously home and community-based services are a bit difficult for everyone to understand. The typical Texas voter, home and community-based services probably isn't on their list of things that they're thinking about when they go to the poll. And it would be really great if that changed, and if we just raise the level of consciousness that we have across the state on home and community-based services issues and the waiting list. And so we're hopeful that this story can do that. So I also provided testimony to the House Human Services Committee back in May, and I included basically 5 different recommendations in my testimony, which I will also provide a link to for those who are interested in the chat right now. I was complimented by the chair of the committee for the way in which I formatted my testimony. And so if there are any fellow advocates, self-advocates in the room today, you may think about formatting yours like mine so that it is effective in the future. Basically what I did up front was just I laid out what the solutions were that we were proposing. And then one by one, I sort of broke down those solutions a bit more. And so what the Human Services Committee was really looking for were methods that they could use to reduce the waiting list or to reduce the HCBS interest list. And so I proposed 5 different solutions. I sort of refer to these solutions as not new songs, but like the greatest hits. These are things that advocates like Dennis and I have been saying for many, many years now, but they just seem to fall flat for whatever reason. But I do think that there is renewed interest this legislative session on doing something that is meaningful on this issue. And I'm very excited to see what we can all accomplish together and what the stories that we tell can really do and the impact that they can have. So the 5 different solutions that I proposed were expanding Medicaid buy-in. So this would be asking the state of Texas to just expand eligibility for Medicaid buy-in to the federally allowed limits. So the feds allow states to have pretty substantial Medicaid buy-in programs, and Texas is just not tapping into that at the extent that we could be. And that's a missed opportunity because we're not getting as many people on Medicaid who could be by not sort of reaching our full potential on that. The next is implementing the TEFRA option. I heard Laura in the beginning that we're going to be really cognizant of the acronyms that we're using, and I apologize. TEFRA stands for Tax Equity and Fiscal Responsibility Act. This is like a Reagan era administration opportunity that passed, and states have an option of whether or not that they implement it. The state of Louisiana, which has been talked a whole lot about whenever we're talking about waivers, because Louisiana recently reformed their whole system of providing waivers. And one of the things that the state of Louisiana has done is implementing this TEFRA option, which basically says that if a child or if anyone under the age of 18 meets an institutional level of care that and qualifies for Social Security, that their parental income can be waived. And so this would be a really big deal for parents who have to spend a lot of money on their child's care while they are waiting on a waiver. This would really help families who are sort of in a predicament to qualify for Medicaid. So it would allow more children to qualify for Medicaid. Another recommendation I made was adjusting the Texas home living eligibility. Texas home living is one of the 7 waivers that the state of Texas offers. So there's 6 waivers that are specific to people with disabilities that Texas offers, and this is one of those 6. So the eligibility for the Texas Home Living Program is at 100% of SSI, whereas all of our other waiver programs are at 300% of SSI. And so basically making it to where it could just be 300% would help a lot more people qualify. And the Texas Home Living Waiver is our most cost-efficient, low-cost waiver out of all of the waivers that we offer. And so helping more people qualify for Texas Home Living makes a lot of fiscal sense, as well as just doing the right thing sense too. Another recommendation I had for a solution was bringing back in-home and family supports. So this is not specific to a waiver. This could be anything, just a service that we offer families and individuals to help them cover the cost of different disability related expenses. The state of Texas used to have this program and it was highly successful, and for some reason it went away. And I'm just asking that we bring it back. This is another one of those things that the state of Louisiana offers that has been really great and has helped a lot of families. And I think that if we revisited this, we wouldn't have so many families in dire straits as they are waiting on a waiver. And then last, but certainly not least, and this is probably the most obvious of all of my 5 recommendations, just funds more home and community-based slots. We just need more money to fund more slots for more people in general. Obviously, I'm in a room full of friendlies. We all believe that community should be the first and preferred option for all individuals with disabilities over institutions. And I would really love to see our Texas legislator agreeing with us. And we just have to continue this message that their institutional bias is showing when session after session, we ask for more home and community-based slots and we don't get them. So I'm happy to answer sort of any questions that might have brought up or any other points you want to make on that, Dennis.
Thanks, Ashley. And I want you to know I took one for the team before that committee, and I actually recommended they consolidate state-supported living centers, close a bunch of them, and shift the money over to the wait list, which did not get I think it got like a feared look from the chair. Not to me, he was friendly about it, but that also is one way.
That like we don't have to operate on these scarcity politics. You know, Texas is a place of abundance, and we should have that mentality when we're talking about services to people with disabilities too. So this whole idea that things are scarce and that we have to pit one against another, I just want to call BS on that. You know, we have an excess amount of funds coming into this legislative session, and there's no reason that they shouldn't be spent on people with disabilities.
I totally agree with that. It was also an opportunity to point out where people really want to live and receive their services. And no, I actually do think that it's hard to justify the state-supported living center network, but we're not talking about them today. We're talking about this wait list, this interest for Medicaid waivers and getting something done. And that was, I think, a good hearing. And I think there was a number of good testimonies there. So I think at this time, we're at the point where I'll kick it back to, oh, wait a minute, Nancy is raising her hand. Nancy?
Thank you, Dennis, and thank you, Ashley. It was wonderful. I'm Nancy Crowther. I'm with Adaptive Texas and the Personal Attendant Coalition of Texas. I was in probably one of the longest hearings in a while last week, having to do with the finance. But I wondered too if, Ashley, if ARC is also looking at the wages for our community attendant and making also that a priority. Not all wages are fair across the board. And now the city just raised their minimum wage to $22. Thanks a lot. But it's really hard to live without that labor force. And it's getting harder and harder. So whenever we can unify our messages to raise the salaries, I think they hopefully will get the message.
Yes, Nancy, I actually provided written testimony during that committee hearing. I didn't stay the whole day there, but I did provide written testimony. It is a priority of the ARC, and we know that we can't just ask for more slots without asking for appropriations to fund the people that would be providing services to the people receiving those slots. So both are needed in tandem. And I think that we have really asked for the legislator. We asked for it during the Human Services Committee that I was just sitting, that I put in the chat, and then as well as the Senate Finance Committee last week, that they really do need to do a better job of elevating their profession. It is appropriate for us to ask for an inflationary adjustment. We see inflation, it's skyrocketing, and so our Texas Medicaid program needs to be reflective of that and the wages that we're providing people to, really do the hard work.
Following breakout discussions.
Amazing breakout I was just involved in with Marianne and Belinda and Reg. One concept that came up, I hadn't really occurred to me before, but listen to Marianne and Belinda talking about their sons and grandsons they're on the waiting list as they go into young adulthood. And the behaviors of males in young adulthood, with or without disabilities, can be pretty challenging. And ultimately, what became clear to me is the time they're on the wait list is the time they most need these services and supports. And there's something wrong with this kind of thinking, but that was a real takeaway I got. I know that Amy has asked for a few minutes to Amy Litzinger. Go ahead and take it away. You've asked for some time to get some comment on this.
Yeah, this isn't necessarily on the waiting list, but it's about federal and the SSI reforms. Some of y'all might know that they're trying to update some of the SSI rules through the SSI Restoration Acts, and we're working on raising the income caps, but Michael and I have been doing some underground advocacy a little bit too. In addition to that, do y'all know what Loving Day is? So Loving Day is the day that we celebrate. In 1967, the Supreme Court struck down the ban against interracial marriage. Well, Michael and I were thinking about how to celebrate this, and we came up with a post about how it's been 55 years since Loving Day, but most people with disabilities still can't afford to get legally married because their benefits get cut if you have a legal marriage, or in Texas if you have a common law marriage. So we wrote up a post about how, in celebration of Loving Day, that people should talk to their legislators federally about, while they're raising the income tax and all the other caps and all the other things that they're doing, they should be talking about how the marriage penalty needs to go away, because you shouldn't be penalized with your services because you choose to legally live together and enjoy yourselves. And our post has gotten over 8,000 reactions on Facebook, and we've gotten hundreds of people to say that they would call their legislators to try to fix this. So I just wanted to celebrate our win. We got something.
That's awesome.
Awesome.
Can I add, Amy, that in addition to that penalty, that if, Dawn has a housing choice voucher, but she cannot have a roommate, couldn't get married, or, she has SSI, but she couldn't even have a roommate because she would lose her housing choice voucher if she did that. So that should change as well.
Right.
These are, I think we're all saying that all these things are related, and what is the single common thread? There's been little to nothing done for a very, very long time. That's why at one time, the amount of income you could have wasn't, so bad, but after 20 years of inflation, it's really what used to be poverty eligibility is now ultra poverty level. This thing about the marriage penalty is ridiculous. That's something we should be doing. We haven't addressed wages. We haven't addressed waiting list. I know that Ted, I'm going to recognize you in just a minute. I'm going to do two things first. I'm going to ask Jolene, you had a comment to make, and please announce what's going to happen in 2 weeks.
Sure. First of all, excellent conversation. I hope everyone's group is engaged in just some really great discussions. In 2 weeks, we will be covering the topic of special education, and one of our strongest allies, amazing leaders in education and advocate for people with disabilities, Representative Dr. Mary Gonzalez will be joining us. I do want to say that we've had this scheduled for a while, and the appropriations set a meeting for the following day. So due to her having to travel, there is a very slight possibility that she might not be able to join us, but she really, really wants to, and she's made it a priority. So if anything changes, we'll certainly get that information out, and we'll continue to have a Raise Your Voice on that day, July 11th. But it may be a different topic, but just look out for any information that's coming from us as an update.
Thanks, Jolene. And I noted in your notes about in your breakout, Anne mentioned the booming population. Again, if nothing's been done for 20 years while the population has increased, things have gone worse and worse, okay? I'm gonna just, right away, I'm gonna real quickly recognize our sponsors, allow us to do this. And then Ted will recognize Ted to take it out. Some of you I know we're a little bit over time, but I will at least stay and listen to what Ted has to say. But our sponsors doing this, our primary sponsors are United Healthcare and Superior Health Plan. Our second tier, Amgen AstraZeneca, Touch of Class, and Shield Healthcare. And we also have sponsorships from Gilead Sciences and We Work for Health Texas. And without them, we wouldn't be able to do this for free, and it matters. So with that, we're technically done. I'm going to stay on and welcome anybody else who wants to stay on. And Ted, you're going to be our last commenter. So go for it.
You're back unmuted, Ted.
Am I unmuted now?
Now you're good.
Okay. Yes. I did most of the talking in our breakout room. And for those of you who don't know me, I do live in a nursing home. I was able to listen to most of the presentation today, but somebody came to the door for about 10 minutes on about the second half of the presentation. And we did discuss me attempting a few years ago to get out into the community unsuccessfully. And then again, a couple of years back to a personal care home, which also didn't work out because the house itself was not ADA compliant. And because I complained about it, got quickly kicked back into a nursing home. My significant other and I came back in. And touching on that, you're right. That marriage penalty should be gotten away with, because as Joanne and I have been together for almost 3 years now, actually over 3 years now, we can't legally get married because it would mess up our Medicaid and, even more importantly, Medicaid for nursing home residents, since we both reside in the nursing home. And by the way, financially, living in a nursing home, after paying your applied income payment, you are left with only $60 a month. And with inflation rates going up, the purchasing power for $60 is practically nothing. And this number has not changed in 50 years. I don't know the exact number of years, but I'm sure Dennis or you or Chase probably do, since you guys do the number crunching. But that number, I mean, yes, our housing is paid for through Medicaid. Our food is technically paid for. But let me tell you, the quality of stuff that they have here isn't great. And we don't have the funds to have quality of life to go out once in a while. Or we really do have to save. And where some people can work from home, well, guess what? This is my home. And I'm not allowed to work, because this is a business. And if I am self-employed, technically I'm running a business inside a business, and supposedly that's not legal either. So there's a lot of things that need to be changed in a lot of different ways for those who have to or choose to live in the institutional setting, either because of safety needs or healthcare needs that go beyond even the items that were spoken about today. again, I tried getting out back into the community, but and Dennis, you and I have discussed this ad nauseum a couple of years ago with that apartment in Southwest Houston that the shared provider care program got shut down because the apartment complex came upon new ownership and new management, and that management shut that program down and forced people who hadn't ever seen the inside of a nursing home had to go to a nursing home because they could not be taken care of in the way they needed to by just traditional provider care services because they needed round-the-clock care. So that's all I wanted to speak about. And I dominated the 10 minutes earlier, so my apologies for that. But I think there were a lot of good takeaways with the others that were listening.
Thank you, Ted. And again, what are we all talking about? Whether it is the marriage penalty and that's $60 a month, yes, it's been like that as long as in the 22 years I've been doing this, except there was I think there was a period of time, maybe 4 to 6 years, where they actually cut it to $45 a month. And then they restored it to 60 and congratulated themselves on how generous they were and not maintaining the cut going forward. But you're right, whether it's paying an attendant, $8.50 an hour now versus 15 years ago or whatever, that's not the same. $60 now versus $60 15 years ago is not the same. And, and again, our community placements do rely on having attendants that will provide care, reliable care, and be there. And can you expect them to do that when they can get double their pay at entry-level jobs, either in a warehouse, a retail, or fast food? The answer is no.